Science, I guess, is just kind of something I've always been good at, something I've always found interesting. I think I find pride in imaging because I know that the more precise and the more accurate and the more attention to detail that we put into our work, and the more we care about that image and that patient, the easier it is for the doctors and the physicians and the PAs and everyone else in the healthcare team to be able to figure out what the next best thing is, what the next step is in that person's care. I feel lucky. I think I'm learning a lot more than I would in any other situation. I think hands-on healthcare learning and being in a clinical setting is the best way for me to learn what I need to know. Having that extra money, that scholarship money, it really makes it easier on me and my parents. I'm just very grateful that someone noticed that there are students that need help, and I think that what they're doing for our program in Allied Health Sciences is fantastic, and it helps me and a lot of my classmates just be able to achieve more than we could have without them. The more I spend time with my teachers and my professors, my classmates, and my preceptors in the hospital, the more I realize I made the right decision.